If you're living with Crohn's or ulcerative colitis, you probably spend a lot of time managing physical symptoms like pain or fatigue. But there's one symptom that affects nearly 50% of patients, yet we rarely talk about it enough, and that symptom is your mental health. So, according to Crohn's and Colitis UK, people with IBD are twice as likely to experience mental health problems compared to the general population. Today, I want to explain exactly why this happens. It's not just in your head, and give you 5 practical strategies to help you cope with this. So, the why. So, first, let's look at the biology. Your gut and your brain are constantly talking to each other through something what we call the gut brain axis. It's like a two-way street. So when you're stressed or anxious, your brain sends signals that can actually make your symptoms worse. And when your gut is inflamed, it sends signals as well, distress signals back to the brain, affecting your mood. Add to this the side effects of steroids, which we know can cause mood swings, and the stress of body image changes. And it's completely normal to feel overwhelmed. So, what's the solution? So, what are the management strategies and what you can actually do? So, the guidelines and the Crohn's and Colitis UK recommend these 5 strategies. The one is the micro task method. So, when you're dealing with fatigue, the whole day a task can feel like impossible. So, the advice is to be kind to yourself, set some micro goals. So, like, don't aim to clean the whole house and aim to wash like just a cup. Accept that you might have to change plans and don't feel guilty at all about it. So, achieving small goals can help you feel you are in control. And move your body even a little. It sounds counterintuitive when you're tired, but regular exercise is proven to boost mental well being. This doesn't mean running a marathon. Low intensity exercise, walking or yoga is excellent. It helps reduce stress levels and can actually help with fatigue over time. Also, write it down. Keeping a mood diary or using a mood tracker app, writing down how you feel helps you spot patterns. Maybe you feel worse after certain foods or stressful events. So, apps like Headspace or Calm can also help with guided medication and relaxation techniques. Another strategy is to connection or the talking tool code. So isolation is a huge trigger for depression. So Crohn's and Colitis UK has a resource called Talking Toolkit to help you start conversation with friends and colleagues. If you don't feel like talking to family, look for people who get it. Join a local network or join Crohn's and Colitis UK Facebook forum. Speaking to people who are going through the same thing can be a massive relief. There's professional support available like CBT and ACT. So don't be afraid to ask your IBD team for psychological support. Therapies like cognitive behavior therapy or CBT are very effective. They help you change unhelpful thinking patterns. There's also called ACT, which is acceptance and commitment therapy, which helps you accept difficult emotions rather than fighting them. So you can focus on living your life. The iron medications like antidepressants that can help lift your mood if talking therapy aren't enough. So remember, looking after your mood is just as important as looking after your gut symptoms. If you are struggling, please speak, reach out to your GP, reach out to your IBD team. And for more of these educational videos, subscribe to my channel and like the video. Thank you.